We titled this session "Navigating the Regulatory Minefield and Essential Governance Pathways." Now, it's a bit of a mouthful of a title, I'll admit that, but our real intention for this last session of the week is for all of you on the call today to get any last questions answered, any last topics discussed, and I have a number of topics that I want to go through, kind of spanning the gamut of DAM as it relates to healthcare. But in order to do that, what we wanted to do is create a panel that gave you a number of differing perspectives on the same challenges. So we have a pretty varied group here. So my name is Jarrod Gingras. I'll be giving you the analyst perspective. We have Karen from Aprimo, who's going to be giving you the DAM vendor perspective. We have Carrie from Abbott, who's going to give you the pharma perspective. And we have Dario from Children's Hospital of Philadelphia, who's going to give you the hospital practitioner side of the house. And so we think we're going to have we have the makings of a really good conversation here. And I think in the lead up to this, we all realized that we all love DAM and we all love talking about DAM. So I think we can talk about DAM for about 3 days, 3 weeks, 3 years without exhausting some topics. So like I said, we put a lot of, we pre-selected a bunch of topics that we want to get to, but we really want to hear from any of you. So please use the Q&A tab and get those questions in as we go through this. You don't have to wait to the end. Just throw it out there, and we'll get to as many as we can as time allows. All right. Without further ado, I've asked each of our panelists to give one slide to set some context, and I'll lead it off by just explaining. As I mentioned, I'm with Real Story Group. We're an industry analyst firm that follows the DAM vendor space as well as a bunch of other marketing technology spaces. And our method is a bit like a consumer reports method, where we try to highlight what different vendors are good at and what they're not so good at, so that our clients can then make the right decision for what technology is best fit for what they're trying to do. Okay, and so we publish some of the hardest hitting analyst reports on the market. And if anyone needs help picking their next technology, I'd love to talk to you and help you through that. So representing the vendor side of the house, we have Karen from Aprimo. Karen, welcome.
Hello, everyone. Happy Friday and welcome to the end of the week. Thank you, Jarrod. I am very excited to be a part of this today. My name is Karen DeWolfe. I am the Industry Vice President for our Life Sciences at Aprimo. And as Jarrod said, I come from the technology perspective of this conversation. I too am looking forward to all of the discussion that we'll have over the next 45 minutes or so. So thank you for having me.
Great. Thanks, Karen. Next up, Carrie, I'm going to ask you to just put on your, oh, there you are. Welcome, Carrie.
Thank you. Hi, everyone. Thanks for hanging in there to the last presentation of the day. I'm Kerry Gilzene. I work for Abbott, and I am a regional DAM digital content customer engagement lead. And of course, I manage those teams. You can see there on screen. I've got several responsibilities. Normally, if things go wrong, I get the credit. If things go right, then other people are very happy. So most of that change management, customer impact strategies, internal operational efficiencies, we'll talk about, of course, regulatory is part of that, marketing operations, making the whole lot work, and content process design, which of course is the oil that makes the whole machine work. So very quick summary from myself.
Great, thank you. And Carrie, you're the only one not on the US East Coast, so it's a bit later in your day. So we really appreciate you taking some time out of your Friday evening to join us today. So that's much appreciated.
Appreciate it. It's pub time, so cheers. I am drinking coffee.
All right, we'll see how your answers are, or if we can validate that. All right, next up we have Dario from Children's Hospital of Philadelphia. Dario, take it away.
Keep it really quick. So, as you can see here, I've been at, we call it CHOP. It's a very unfortunate acronym for a children's hospital, but it's a lot easier to say than Children's Hospital of Philadelphia. But I've been there for a while in a whole bunch of different roles. Me and pretty much one other person are the creative operations of the whole marketing department. I've been in this field for pretty much my whole career in one way or another, and I've dabbled in many other areas of it. Just looking forward to this riveting discussion about regulations and governance and enforcement. So.
All right. Well, thank you. Thank you all very, very much for being here. It's much appreciated. Let's just jump right into it. You know, when we talk about healthcare, you cannot never have a discussion without bringing up the topic of HIPAA, right, and privacy around as it relates to assets in a technology and the patient and potentially staff implications that are related to those assets, right? So I just want to jump off here at a real high level. You know, when it comes to HIPAA, what are the biggest challenges that you all face? You know, what comes to mind when I say HIPAA? What rises to the top? What do your organizations have to deal with the most? And Karen, I'll start with you from a vendor perspective. When you hear HIPAA, what are you thinking of?
Well, you know, it's interesting because from a vendor perspective, the first thing you hear is, are you HIPAA compliant? And there's a lot more than that, than just the technology. There's all of the process that goes around it. So we are as HIPAA compliant as our customers are in putting processes into place. So from a technology perspective, we have the capability to handle the strictest of data. We have the capability to make sure that, you know, everything can be centralized in one place. But again, it's the process around HIPAA that I think everybody needs to pay attention to. So without process, without our process, any vendor process, and the commitment of the customer, you don't have a HIPAA compliant situation. So when I think of HIPAA, I think of a lot of people that have to move together to make sure that the process end to end is compliant.
Yeah. Carrie, what about from the pharma side of the world? You know, how does HIPAA impact your world?
Yeah, good question. So from where I'm sitting, HIPAA is all about, of course, ensuring that the public is protected to a certain extent. And it's the rules and regulations which guide, to a certain extent, privacy by design for organizations putting in place various capabilities. So as a manufacturer, of course, we are running, well, as Abbott, we are running a consumer and a pharma operation. So whereas we are marketing to mothers and the general public, we've got certain campaigns which we are able to take some data because these folk are not patients. So there is a certain level of HIPAA, which is mostly for US and GDPR equivalent kind of in the UK. With our pharma side, once again, these regulatory standards still apply because, of course, we're handling data. We have a very large external presence globally. So HIPAA is one part of it, let's say, but of course, we'll come on to other elements. But for me, HIPAA, privacy by design, make sure it's all locked in, good workflows, so that we are doing what we should be doing as a business.
Great. And then Dario, I think we could all have suspicions of how it affects your world, but give us some color around how it affects CHOP.
Well, I mean, the thing with HIPAA is it's like a wonderful, awesome thing for patients to keep everything private. But on the back end of that, it's a very challenging thing for the people trying to manage all the assets and all the data. So there's, I mean, like numerous challenges involved. Like, first of all, I mean, Google HIPAA compliant DAM and see if you can count them on more than one hand. Like, it's ridiculous. But it's more than that. Like, for us, it's not just a matter of like a HIPAA compliant DAM. You need the vendor to be willing to sign a business associates agreement to take on the risk of HIPAA as well. So it's not just on us. You know, requires them to report a breach if there's one. It requires them to kind of own up to their responsibility. It brings them under the same umbrella, and there's not a lot of vendors that want to do that. But it's also like, it shifts the mindset for the DAM. Like, in a normal instance, you're setting up the DAM, you're focusing on things like user experience, you're focusing on things like searchability. But when like HIPAA's involved, nothing's more important than security. Like, that always has to be number one. So you have to ask a lot of questions that you wouldn't normally. Like, For example, if there's a plugin that you use for AI, if you're using, utilizing somebody else's, is that leaving the HIPAA secure environment to do that? Because if it is, you can't turn that on. So there's a lot of, normally you ask the like, why do you want to do this? Why do you need this? But you have to ask how all the time when you're searching and when you're implementing a DAM, when you think about HIPAA, because just because something's HIPAA compliant, just because something can do something, you have to make sure that the how it's doing that is staying within that compliance.
And Dario, I think you spoke right to my point, right? It's the process. You can have technology that can do it all day long, but if your process doesn't support HIPAA and does it fall outside of it anywhere, you have to pay attention to it. And the BAAs are ever important to make sure that the technology vendors also have some skin in the game with you, right? So it's the technology, it's the process, it's everything that goes with it, because there is a lot to it, more than just a tag of we're HIPAA compliant. It's that we stay HIPAA compliant throughout the process.
And it hurts a lot when you're putting stuff together. Like I'm a user experience guy to the core. And like you have to make decisions sometimes where like, this is going to be harder for the user, but we have to do it. And like, that's just the reality of the game and the situation. And you have to be willing to kind of accept that.
Jarrod, we had a situation, and I'd be interested to know if Carrie and Dario end up in this same boat where you have celebrity endorsements. That's a HIPAA information because you're putting a diagnosis out there. So you've got a celebrity, they've got a condition, they're in all of your advertising, they're in all your promotional material, your commercial material. You have to have some sort of document, you need to have some sort of sign off with that, because although they're a celebrity, it is still their protected information.
Yeah, how about that, Dario and Kerry? Yeah, you encounter that too? Yeah.
Well, celebrity stuff, for the most part, we try to not even go down that route, because for us, it's like someone's visiting. Sometimes they don't even want people to know about it. And at most, we're probably doing it for like one social post somewhere. So we're not even going to bother trying to put that sort of stuff into the DAM. But it would definitely be an issue if we wanted to kind of go that route.
Yeah, and for me, Karen, you're absolutely right. You've hit the nail on the head. Public information, you will see that Abbott has signed a long-term agreement with Real Madrid football team for nutrition. So I'm working with the team, with all of those celebrities at Real Madrid on nutrition. And funnily enough, since we've started giving them our products, they've been winning all manner of games. So and Champions League matches as well. So we take credit. But yeah, you're absolutely right. Dealing with celebrities and content and image rights and public information and named information, especially if we're looking at footballers like Karim Benzema, there is a lot which needs to be considered. And if I could just develop that point, and also for the audience, because I'm conscious that we want to have some questions coming in. So to that point, and to that HIPAA point, and to the idea that we need the right workflows in place, I couldn't agree more, because ultimately, at the end of the day, DAM and digital practitioners should have a level of privacy and legal understanding, although that's not their core job. And the reason for that is the ability to persuade anyone within MLR or regulatory or approval that what is being developed is something which is permissible, let's say. And for anyone in legal that is not a digital expert having to make those kind of decisions, it's much easier to say no, which means as digital and DAM people, and I'll come on to the importance of us as DAM practitioners a bit later, it's well worth having those tools in your armory so that you could persuade your MLR folks of certain directions. And then what I mean by that is the successful delivery of these new workflows that we've talked about needs two things. First is the co-creation of the workflows, the concepts, the tech, and all the things that we've mentioned, and the DAM and the content capabilities. The second one is a good mechanism of arbitration. That means when medical or legal are saying, you can't use that content type in a WhatsApp channel, or you can't use it as an item in a sales aid, or you cannot use it in XYZ, or you can't use digital and modular content in a certain way. There must be a mechanism of arbitration, because otherwise we'll get stuck. And in that instance, and for the audience, compliance is a good department that can intervene, and you could use them well in that arbitration. And more often than not, compliance will say, we've not seen this before, but it's not breaking any compliance rules. The objection from legal, it's not a legal objection, it's a compliance objection. We say you can do it. And that's how those two parts come together. So co-creation of what you want to do, bringing in the right stakeholders in that co-creation, the workflows. In terms of who coordinates that, that's another question. But what I will say is, us as DAM practitioners, we get to talk to folks in many different departments. We get to talk to folks in IT. We get to talk to folks in CRM, marketing, digital. So if we are sitting at the center of that activity hub, why don't we use our influence and power instead of being considered as a support service or capability in order to drive the narrative? So to me, to the audience out there, that's the power that you've got. Look about the working relationships that you've got with different departments, and then you'll see the influence that you could bring to bear, but also the additional skill sets that you've got where you're able to talk the different languages. And then just a final point, and I know we'll come on to it later, different contents from DAM to different channels with integrations and compliance and metadata. Those are all things that could trip you up, but you know, we'll leave you some wise words later on. So quick summary from me, but yeah, comments from the group.
I wanted to mention one more thing. I mean, Carrie kind of definitely hit the point. Like, you need to have the right people at the table, and when HIPAA's involved, like, there's people at the table who wouldn't normally, like, when you're negotiating for a DAM, supply chain, legal, they'll be involved, but then they're done. But like, they have to always be at the table for a DAM when HIPAA's involved, because it's like, people love to put something in place and be like, cool, all done. But like, HIPAA is always changing, like every day, because so much of it is based on interpretation. And what does legal interpret this clause in this, you know, act to mean today? And it might change based on a lawsuit that happens. So like, they have to be involved in the process and the discussion for the life of your DAM, or things could get missed, things could get put at risk. And like, it's not something anybody really wants to do. Like, who wants to get legal involved in the process, because they have a really good way of making things complicated that should be simple, but like, that's their job, and they're looking out to, you know, protect the institution and protect the kids. So like, it has to happen. It's not the funnest thing, but they have a very important role in this. And I think they're very much overlooked a lot of times when you think about this stuff, and you get really far along down the process, only to find out that like, you can't do any of the stuff you just spent a year planning. And like, you never want to be in that situation.
Exactly. And Dario, to that point, to you and Carrie and Jarrod, I apologize, I'm asking some of the questions here. You bring up a good point that comes up a lot for us. How much does content planning come into that for you, so that you're knowing what you're going to do and when you need to have all of those people involved in a seat at the table?
Well, you have to take it even further back than that. Like, you need to know how your institution like defines something as simple as PHI. Like, if you look at CHOP and like our legal and our, you know, InfoSec definition of PHI is a photograph of a patient. That's it. There doesn't have to be any identifying metadata. It doesn't even have to be a photograph of them in the hospital. It can be a picture of them at their house playing with their dog, but that kid's a patient of ours, so that photograph is PHI. And that means, I mean, it doesn't matter at that point. Every single thing in our DAM is PHI at that point, because like, we're not putting pictures in the DAM. What's the point?
Right.
So, I mean, it's even something as simple as that. Like, how does your institution define PHI? If you don't know the answer to that, find out, because it's pretty important.
Yeah, definitely.
Yeah, oh, absolutely. And then, you know, for me again, of course, speaking to the audience with my manufacturer hat on, let's say, you know, most of you in the audience will be involved in operating systems, using tech, of course. And when it comes to putting these capabilities in place, you, of course, will have your DAM system, which is most of the conversation today. Before that, some of you may have clever content authoring capabilities, which have their own metadata, which enable your content to arrive in your DAM at sufficient content velocity. From your DAM, you may have something else which approves that content, unless you've got an approval and DAM capability all in one. Most haven't. Then what you need to do is get that content from your DAM into your channel. What I mean by that is either it's a sales aid on an iPad that's connected to your CRM, either that's content going out via WhatsApp to channel, either that's content going out to your webinar system, which again is a separate ecosystem in most cases, or it could be your email content. All of that stuff, of course, sits in your DAM, and then getting it into your DAM at a good price and at speed needs some sort of level of content authoring. And then once you manage to get that to approval, then you've got to get it to your channel. What I'm trying to say is one person may be the DAM practitioner, but we are speaking with many different folks: marketing, regulatory, legal, MLR, content velocity. Are we in compliance? Does the metadata match? Is this campaign fit for purpose? What are the risks to us as an organization if we put this out there, let's say? And it's very important from a compliance and regulatory standpoint that your systems, and someone's got to do it, are all joined up and talking to each other. But of course, your metadata in your content authoring may not be the same as your metadata string in your DAM. And then when you're trying to do advanced things like connect your DAM to your marketing cloud, or your DAM to your webinar separate system, you've got to move that content and the metadata. When that content arrives at the end user, your customer, that content has got to be able to talk to your CRM, and it's got to pull back the relevant metadata, and it's got to pull back only that relevant metadata that keeps within HIPAA, GDPR, or the rapidly moving European set of rules and regulations, which keeps us forever busy.
Yeah, so Carrie, I think what you're describing, I think what you're describing here is that, this is a complicated process, and at a DAM conference, it's easy to just talk about DAM as a solution. But what you're describing is, no, there's a whole ecosystem upstream, there's a whole ecosystem downstream, and they all need
the
to
DAM guys are seeing everything,
language.
and you DAM guys don't realize that you're seeing everything you see. So that's my superpower within Abbott. And once I realized that, I thought, right, I can go and strong arm those guys in legal, meaning your objection is a compliance objection. It's not legal. Of course you can do it. Compliance, say you can. Great bit of arbitration. Yeah. Or here is a new innovation which we can do, and DAM makes it permissible. Then I can go around to all those different departments, regulatory, legal, medical, GMs, and drive that innovation. Otherwise, you wouldn't get it. So that's the superpower of DAM practitioners, really.
It's true. It's true. So I want to switch gears slightly, but not all that much, right? So when we talk about a lot of what we're talking about, we're getting around, hey, in order to do some things, we need consent. We need to manage consent, right? And so we have all these assets. Nominally, we have some sort of consent, and someone already in your comments, brought up the fact that sometimes we have a signed document that says, hey, you have my consent to use this in this context and whatnot. How do you do that from a practical standpoint? Where do those consent documents live? Is it always a document? Is it document and metadata? Is it metadata and not a document? So what, from a real practical standpoint, I want to understand, how do you manage consent alongside your assets? And maybe Carrie, you're the other vendor here. I'm curious how you see your clients handling that ongoing challenge.
So from my perspective, was that Carrie or Karen?
Oh, Karen.
Karen.
Let's start with Karen,
Karen.
and then we'll go
I
around.
mean, quickly from a vendor standpoint, it's easy from an enterprise DAM because you've got associated documents. So for any asset that you have stored, you have the ability to have related documents that stay with them. And we do have some customers that have an outside repository, so you can use a web link or whatever if it's going to somewhere else. Most of our customers are using the associated document as a space in the DAM of consent documents that live there. They're always updated. If the consent form expires, the asset expires, and it all happens automatically so that you don't have things out there. So it's a very easy way to manage consent in one place, because if you've got it in two, you've got a point of failure to pay attention to.
And
Yep,
Dario,
that's a really good point, Karen.
Oh.
Yep.
Can we just go to Dario next? Because I'm just curious about one issue here. So Karen, so you've described one environment. I think it's probably going to be similar to Dario's answer because, Dario, you already told us that everything is PHI in your world, right? So you, and Karen, that's what you described too. A situation where if you're going to have consent documents in the system, that's all well and good. I mean, I can say I've worked with some healthcare organizations where they didn't consider everything PHI, right? So they had certain things as PHI assets, and then or certain things as non-PHI assets. They were just digital assets, that they considered separate. But for those digital assets that they needed consent, they linked to a separate system, and so there might not be a one size fits all for everyone. But Dario, let's go back to you. In your world, I would guess that you kind of put everything in the DAM. Am I right about that?
Yeah, like the storage is the easy part for us. I mean, the goal for us is everything goes in the DAM. The challenge with consents in our world is actually getting them done properly and putting those processes in place. I mean, it's simple for something like we're going to photograph a kid. They're going to come in, like that's easy. You get the consent, it's done, boom, it goes in the system. You don't even really have to tag it because all the data about the patient is in there, which just links up to the thing based on just a search. But the challenge is when you start to think about events, big fundraisers, there's thousands of people showing up, and like there's different regulations involved for consenting. So like everybody there would have to sign a media consent. Sometimes you can do that with just a poster that says, if you're coming to this, we're taking pictures and we're going to post it. But where it starts to get a little trickier, and where, why it's important that legal's involved, is like, what if there's patients showing up at that event and that event is supporting cancer research? Like suddenly you have those images living in the DAM, but you have to get consents from a HIPAA perspective at that point then, because you're starting to disclose conditions and things like that. So that aspect of the consent is where the challenge is in my world. Is the storage is easy because we have a system that's secured, they sign the BAA, boom, everything's there. But getting them to where they need to get to. And then on the flip side of that is like, you have all, historic stuff was done on paper with pens in binders, and like getting all that stuff digitized, properly named, takes a lot of people, and we have two. So that's a challenge.
And Dario, managing that, right? Because it changes, they expire, they don't live forever. So just because you have a consent doesn't mean it's consent 2 years from now and for the use that you're using it for.
Well, one of the things we've done with our consents is we've tried to make them as long lasting and broad as possible. So we've taken a lot of, like so you go to the hospital, you sign a HIPAA consent, that's good for like 90 days, blah, 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 or to disclose to one person. We have legal work up new language into a like media specific HIPAA document, which adds a little more time to those sorts of things and makes it more specific towards media, that sort of stuff. So we've addressed some of that aspect of it, but it's just the logistics of it. Like, how do you consent people? You're going to a big fundraising event for really rich people who are donating like $10 million to the hospital. How do you make them wait in line to sign a consent form on an iPad? It's like, you do it, but then you have to manage the relationship. There's lots of other things involved when you do that sort of stuff. And it's just the manpower involved to kind of manage that is a challenge.
Yeah. And Carrie, at Abbott, do you manage all of your consent forms and documents within the same system alongside of the assets?
Yes and no. So we, of course, are trying to reach as many of our doctor customers as possible. Let's say, I don't know, a good 500,000 right across Europe, all being said and done. In the ideal world, we will have them all fill in something online, an invitation to a webinar or some such activity. We would need the consent copy and text worked out, and many folks leave that consent copy and text until last in projects, and that generally doesn't really have a key owner within an organization. So I've seen CRM people trying to manage consent and drive it. I've seen marketing people trying to drive consent. I've seen DAM people trying to drive consent. So where is consent stored? We've got our systems joined up, but it's multiple systems we're working with. So if someone signs up for a webinar, all of their details goes in, they click consent, they can join that webinar, the detail is logged on a webinar system. And at the same time, that data and proof of consent is more or less stored in our Marketing Cloud CRM, again, not giving away any secrets, which means that the CRM is able to determine which people receive which communications and assets depending on their level of consent, which is preference center in Marketing Cloud. Also, in addition to that, it's important to have the right level of consent, meaning your rights management in your DAM, which means certain assets ask for certain audiences, which also means because you've got consent tick boxes and consent mechanisms in multiple systems, somewhere there needs to be a source of truth where that consent sits. And also there needs to be that governing consent management protocol, let's say. And we use Marketing Cloud. And my final point is we've got different systems, but it's all in one place, and the paper and the proof of consent has to be there. And when any person wants to see their information or their right to unsubscribe, that's got to all be in place. And for anyone talking about HIPAA and consent and all the rest of it, any customer or doctor or patient can turn around and say, look, give us all the data you got on me. And you better be ready to cough it up in 2-3 days. And if you can't, you're in trouble. So that's why competitors are testing the defenses of us and probably others regarding consent, privacy, GDPR. They may sign up for a campaign and then request all of their information back. They could, masquerade as pseudo doctors. And the amount of organizations that are getting tripped up because they haven't done stuff and got stuff in place. And from my point of view, if I even see weaknesses with some competitors or others, I am tempted to register, ask for a bunch of difficult stuff, and then raise a complaint because I know they can't do it. But of course, we're not like that. So, it's really important, just internally and externally, to have your ducks in a row, and then we can keep our jobs. So that's another one for you DAM people to keep in the back of your minds.
Jarrod, I think one of the most important points on that is governance. No matter what systems, no matter how many systems, no matter what it is you're doing, is having a governance plan, because you don't want one way of consent for one thing, one way of consent for another, and then not having, to Carrie's point, that center of truth. You have to have a governance model around it, and everybody has to march towards that same goal. And
going back to an earlier point too, with everything is constantly evolving when HIPAA is involved. So even consenting. So legal needs to be involved everywhere. A classic example from us, about a year ago, we were informed by legal that every employee needed to have a signed media consent form. Previous to that, they were consented just by being an employee. So that came into place. So we had to figure how are we going to suddenly consent 20,000 people preemptively? Because you don't want to, if we're photographing a surgery or doing video of a surgery, you don't want to say, okay, everyone stop what you're doing. You need to sign these quick. And It's like, no, they're doing like an open heart surgery on a 6-month-old kid. Like you're not even supposed to be there. So we're trying to be as fly on the wall as possible. So you have to hit those things preemptively. So we had put something in place. Everybody does employee orientation. Everybody does ongoing education. So we started working a consent process into that, where it was the last step of it. But then on the back end, how do you then marry all of those people who opted in and opted out? And how do you put processes in place to, if you go to one of these surgeries, to like know ahead of time who's going to be in there? Are they consented? If they're not, how do you get that? Or how do you let somebody know that you can't photograph that person in this room?
Right.
So there's a lot of that stuff. And if you don't have people like legal involved in the process of the dam throughout the whole life of it, things like that could be missed, and suddenly you're putting your institution at risk. So
And
and
Dario,
ironically,
just a quick one.
yeah, sure, go ahead.
Dario, have you been persuasive with your legal people? I mean, from my point of view, they always used to eat in our restaurant at lunchtime. I knew I could find them there. After 2 months, they just stopped eating in the restaurant. So have you been really good about persuading your legal folk to a course of action and helping them to expand their skill set? And
I'm not, if anybody's able to do that, I'd be delighted to know. No, there, I mean, legal people are, I mean, this isn't, it might sound bad, but it's not. Like, they're doing what they're supposed to do, but they're not going to be like, yeah, sure, you can do that, because suddenly they're on the line for it. So it's all about risk. So the response is almost always like, if you're willing to take on the risk for that, or if someone's willing to take on the risk, we can sign off for it. But if something goes wrong, it's going to fall on that person. And that's as much kind of movement as you can usually get from legal, right? I mean, rightfully so. Like, they're doing their job. Their job is to protect the institution and to protect the patient. So
right. And ironically, what we've been talking about so far, while seemingly extremely daunting challenge, you know, what we've talked about so far is like managing these things internally, right? And that's the easy part. Well, so let's switch gears a little bit and talk about what happens when things leave the dam and go out into the world, right? And so how do you track where things are? Now, normally our dams should help us with this, right? And, you know, so I'm curious from all of your perspective, you know, how do you know where that asset's being used? And then an extension of this is, you know, God forbid there's a crisis, or a, you know, at an individual patient level, or a, you know, a worldwide crisis where something needs to be pulled back, you know, whether, you know, maybe a patient dies or something to that effect. And how do you do that? You know, how do you know where everything is, and then how do you pull them back?
I mean, from my perspective, you know, from a technology perspective, I think you can expect that I'm going to say you can do it a lot of ways, right? The DAM central to that, using CDN definitely central to that, because you can have a one-click retrieval. So having that sort of capability to have public links and things of that nature, and not putting physical assets downstream and in different systems, having a way to link back so that you can pull them back as soon as you need to. And like I said, knowing where everything is from a CDN standpoint and being able to have one-click retrieval is of utmost importance when it has to be taken down quick. And the technology, of course, can do that.
Yeah, I couldn't agree more. And it's crucial to have a DAM system where one can utilize as much digital publishing as possible, which means that retrieval is that much easier. I know Karen's alluded to that earlier. And then secondly, everyone will always have an emergency at some point, every single company. And as long as you as an individual or a DAM practitioner have got your ducks in a row to make sure your bit is fine in an emergency, that's great. So your digital publishing from your DAM, which means the picture is in your DAM. Of course, the URL of that picture might be placed on your website or on your email, and anyone receives the email is able to see the picture, but the picture lives in your DAM, literally. So with a recall and rights management set up in the right way, those campaigns expire, that content can never be seen again. Of course, what you require is as many of those systems joined up as possible. And again, for most of you who are industry side, systems like Marketing Cloud that may be covering the bulk of your channel output it's going to be incredibly important that you find a way to link your DAM and your digital publishing with Salesforce Marketing Cloud. Otherwise, you'll be stuck and you'll end up putting physical content in your Marketing Cloud, physical content in your DAM. You'll have other content in your Adobe Experience CMS as well. It's just a nightmare. So yeah, you just don't want to do that. I won't go on further, but yeah, we don't have those problems.
But and like a big part of it on top of just the systems is like training and like, so our DAM, for instance, you can't download something without saying what you're using it for. But like, you have to put some onus on the people using the DAM that like, when you download something and you use it for that, you're only using it for that. You're not putting it in a folder and saying, oh, I'm going to keep this little collection of things I like, and I'll just, because that defeats the purpose of having a DAM and tracking these things. And in my perfect world, nobody will ever be able to download anything ever from the DAM. It's always going to be an integration. So I'm in InDesign, I put a picture box in, I link out to that image in the DAM. You know, I'm in Drupal, same thing. I'm in PowerPoint, same thing. That way, the DAM can just say, Pete just went here with Word and placed this picture in the file named this, which is saved here on this day. Like, that's my dream scenario. But I mean, most of you have worked with DAMs before, like that doesn't exist right now, as far as I've found. But there are many things that can be put in place to address that. Like I said, you can't just download something. You say what it's for. We're in the process of putting a new project management system in place, which we will then integrate with the DAM and start to try to automate some of those workflows. As you know, you work on stuff in project management, it gets finalized, it gets pushed into the DAM, and then those links remain. You use things like embed codes for, you know, anything on the web. But then there's also the other aspect of that for us is like, how do we set up processes internally to inform us of when those things happen? Like, patients are really sick at hospitals, some of them don't make it, and there's nothing automated right now to be able to notify us of those things. It's manual check-ins weekly or monthly between account managers and different clients. So trying to find ways to automate that, whether it's getting a report out of our, you know, patient record system or pulling from a, you know, master data warehouse somewhere, so that anytime patient IDs are, the word is expired, which is a terrible word, but like a patient passes away, that ID goes with it. And if the DAM is then notified of that, it can automatically expire all those assets, but then also running a report. So show me every asset in the system linked to this individual. Now show me every project that's ever been done using any of those assets, and show me the teams that are involved in those projects, and then notify those teams that they have 10 projects with pictures of this kid who now have to be addressed. Sometimes it's fine to leave them there. Sometimes they have to be redone. Sometimes it's video that has to be reshot. So there's a lot. I mean, it's a lot more than just the DAM.
It's the governance
business.
piece of that too, right? It's all the business rules. It's all the process. It's the end to end.
It's and it's training. I mean, it's down to just training as well, and putting some, you know, it's like you get vendors to sign BAAs, but it's the same sort of thing for employees. Like, you can't do this or you're possibly breaching HIPAA. Like, stop. So it's
and technology's come a long way too, right? So a lot of those things, you know, are possible today. You know, the digital, you know, record and track of where things are being used, and you know, even from, like Dario, like you said, from the creation piece, you know, when you're working in Photoshop all the way out till something's out in a social channel or on a web page or in an app or something like that. So the technology is there to do that, but you're 100% right. You need to leverage. If you think technology is going to solve all that, you're completely wrong. It has to have a process on it. You have to have ownership. You have to have governance, because it doesn't work otherwise.
And it's taking things further than that too. Like, you work with print vendors, and those print vendors are getting these images. Sure. So like, you have to make sure that they're abiding by the same rules. And I mean, speaking of like print vendors, this might be veering a bit, but like, there were even things we had to think about, like when you download an image, there's a ton of metadata associated with that image. That's PHI, like conditions, names, ages. So like, we had to work into our DAM nothing, like metadata does not come down with the asset. The only thing that comes down is like copyright, who took it. There's like a few pieces of IPTC stuff that comes down. Everything else gets stripped when it's downloaded, because you don't want to risk sending these files out and then suddenly someone on the vendor side now knows that this kid has this and he's this age, and here's it. There's just so much stuff you have to think about that in a non-HIPAA world you don't have to think about. And
no, you're right. And it's important to remember too that when we talk about omni-channel, it's not all digital, right? You know, print, I think you bring up a great point, because print is still very real in our world. It's a very important channel in a variety.
Digital's easy. Digital's easy. There's always a digital record. You know, you can put something in place that finds where all these are. But once it's out of that digital world, it's a whole other challenge that needs to be addressed. And it's both challenging and fascinating and exciting.
So I just wanted to just jump in real quick. Now we're running a little short on time. We have about 4 minutes left. So I was curious if we could just go around one more time, and, you know, is there one piece of advice you want to leave people with here today? Maybe something that we haven't talked about that maybe you think you would have liked to have known 5 years ago, you know, as it relates to digital asset management and healthcare in particular. You know, is there some, you know, lasting advice you'd like to leave the audience before they go off and watch the Masters for the weekend? What do you think? Carrie, you want to start us off?
I'll start and say it.
Karen?
Oh, sorry about that. I'll just start quick and say, from my perspective, it's the technology, but it's also the governance, right? It is the process. It's the same thing I started with, because the technology can do what the technology can do. It's ever evolving. It can help with all of these things, but you have to have governance. You have to have process. Everybody needs to know what your end goal is, and everybody has to work towards that. So not having a governance model in place for all of these topics is the biggest pitfall that you can have.
And Karen, thank you for promoting the non-vendor side of the equation. Usually I'm the one saying the vendor's saying they can solve everything. So thank you for being forthcoming with that. We appreciate
25 years in this, the governance matters.
And to the governance point, make sure part of your governance model is enforcing the governance, because like you can write up the rules all you want, but if you don't put in some line of enforcement, who cares? Like, why do the rules even exist? If I were giving advice, it would be sort of things I've hit on already, like always ask how. Like the why is important, but always ask how. And no offense to the vendor side, but never just let them get away with, yeah, we can do that. Show me how you do that. Like I've been told way too many times that like, yeah, we can do something. And then suddenly you get in there and they can't do, like they can't do the things that they told you. So have them show you, send them use cases, be as specific as possible. Like Timmy gets this in, it goes here, and then we want this to happen, and then this happened, and then it goes here for approval, and then here, and then boom and boom and boom. Be as specific as possible, hand it to your potential vendor and say, I want you to demo your system doing this. And if it can't do that, it's either something they need to roadmap, it's something that you're willing to not put in your system, or you can't go with them. Like,
I concur. I agree with you.
I agree. All right, Carrie, you have 1 minute left. So the last word.
Sure, thanks. Yeah, a couple of things to the audience. You will have noticed that you're producing 3, 4, 5 times as much content as you were last year. So everything we've talked about is only going to get worse for you. I can tell you that now. We are looking at maybe delivering 200 individual unique new emails in a campaign, let's say, in a period. How do you make 200 emails, get them approved, put them through DAM, broadcast them without making a mistake? And that will only get worse. Most of what we learn is by talking with other people, us in DAM and conferences like this, lots of info sharing. For some of you who don't think most of this conversation landed in the right place, keep talking. We are here. I've learned as much as I know talking with other people. There's no damn book that's written that's, well, not swearing, but digital asset management book that's written that is going to give you the experience with people like Dario, Karen, and myself. And finally, I'm not a smart guy. I've seen it all before, and it's a function of experience because I talk to people. So keep talking to us, whatever level in your career that you are at. we are not being paid to do this, and we're passionate about what we do. So we are open. Approach us on LinkedIn, and then we can give you some tips, because we all win together, basically. Yeah,
that's great. Well said, Kerry. Thank you for that. And I'll echo what you just said, and feel free to contact any of the panelists on LinkedIn and keep this conversation going. Because I mean, like, I think you can get one thing out of this is we all love DAM and we all love talking about it, and we're happy to keep having those conversations. So on behalf of Henry Stewart, I just wanted to thank all of you for joining us today, and a special thank to our panelists, Dario, Karen, and Kerry. Thank you so much for sharing your experiences with the group. It was great, and I wish everyone a great weekend. And I just want to put out a plug for this September, where the Henry Stewart Dam is getting back together. The community is getting back together in New York City in September. That's the plan, at least. And I know I'm speaking for myself, but I think I'm speaking for others as well. We're really excited to get to see people face to face. I was earlier this week. I was on a non-DAM conference for the first time in a while, and it was a much different experience, and it was really fun to actually see some people in person. So I hope to see many of you there in September, and all sorts of times next year. So again, have a great weekend, everyone. Thank you for joining the Healthcare Day of DAM Industry Week, and we hope to see you again soon.